Welcome to the Deep Dive. Today, we're really jumping into something fundamental, but honestly, often kind of misunderstood or just not talked about enough: men's sexual health.
Yeah, there's definitely a lot of noise out there, isn't there? So for this deep dive, we've, waded through quite a bit. We've got research articles from urology journals, some great stuff from expert interviews, particularly this one urologist on YouTube, plus info from health organizations.
And our mission, really, is to give you the shortcut. We've gone through it all to pull out the most, important and maybe surprising bits of knowledge so you can feel genuinely informed, kind of cut through the myths.
Exactly.
Okay.
Because the sources are super clear on this. It's not just this one isolated thing. Men's sexual health is tied so deeply into, overall physical health, mental well-being. It's all connected.
Okay, let's get right into it then. Because maybe the most striking thing from all these sources is how much sexual health can actually be like an early warning signal for the rest of your body.
That's a huge takeaway. Erectile dysfunction, ED, it's not just about sex. The research really points to it being potentially a significant early sign of cardiovascular issues lurking underneath.
Wow, okay. That's pretty serious. So ED could actually flag that something's up with your heart or blood vessels?
That's right. Some of the data was, pretty stark, suggesting that a noticeable percentage of men with ED might actually face something like a heart attack within, say, 7 years or so. It's like a preview of their vascular health.
That really changes the perspective, doesn't it? So why? Why that connection? Why would erection problems signal heart trouble?
Well, it usually boils down to blood flow, vascular health, basically. Think about it. The arteries go into the penis or, smaller than the ones for the heart. So if there are blockages starting, maybe from cholesterol or plaque, they can affect blood flow there first, like the smaller pipes getting clogged before the main ones.
Okay, all right, so here's where it gets really interesting. This connection means that dealing with ED isn't just about sexual function. It's actually a chance, maybe even a life-saving one, to look at overall health.
Exactly.
Going to the doctor for ED could, and really should, trigger checks for those underlying things: cholesterol, blood pressure, vascular stuff. It might get someone to their primary doctor or even a cardiologist when they wouldn't have gone otherwise.
Precisely. It kind of pushes that conversation and investigation into areas that could have much bigger consequences later.
Yeah.
And speaking of consequences, the sources were really emphatic about a major risk. ED drugs like sildenafil or tadalafil.
Yeah.
They can interact dangerously with certain heart meds, particularly nitroglycerin, used for chest pain. Taking them together can cause a massive sudden drop in blood pressure. Really dangerous.
Okay, another very strong reason why you need proper medical advice here. So, all right, vascular issues are a big one. What else do the sources say are the main causes of ED? Let's demystify this a bit.
Well, besides the vascular side, psychogenic ED is also really, really common. That's where things like stress, anxiety, maybe performance pressure get in the way.
Ah, the mental side of things.
Totally. The sources really hammer this home. Your brain is arguably the most powerful sex organ. If you're stressed, anxious, just not mentally there, it has a huge impact. And it can become this vicious cycle, right? One bad experience leads to anxiety, which makes the next time harder.
Right, the worry itself causes the problem. What about low testosterone? Because that feels like the thing everyone jumps to these days.
Oh yeah, it gets so much airtime, doesn't it?
Yeah.
But the sources, very clear on this. Hormonal issues, specifically low T, are actually a much rarer primary cause of ED than you'd think. The data suggests it's only responsible for maybe like 3 to 6% of cases.
Wow, okay, that is probably a big surprise for a lot of people listening. So what's the takeaway then? If you're dealing with ED, the message from these sources is don't just assume it's low T. Look at vascular health. Look at psychological factors first.
That's the crucial insight, yeah. And that naturally leads us into something the sources kept coming back to again and again: the power of lifestyle changes.
So like the foundation, not just an extra.
Absolutely the foundation.
Yeah.
And it ties right back to that vascular connection we talked about. Basically, anything good for your heart is good for your erections. Simple as that, often.
What specific lifestyle things did the research really focus on?
Okay, so maintaining a healthy weight, crucial. Physical activity, strongly linked to better function. They even mentioned exercise therapy being helpful for ED, sometimes even after things like prostate cancer treatment.
Interesting.
And there was a sort of interesting point about cycling. Studies comparing cyclists with runners and swimmers in sports clubs didn't necessarily find higher ED rates in cyclists overall. It might be more about, specific bike seats or how someone sits causing pressure, not cycling itself being bad for everyone.
Oh, okay. That's a good clarification. Diet came up too, I imagine.
Oh, yeah. One source specifically linked a plant-based diet with better sexual and urinary and hormonal health, particularly in men treated for prostate cancer. The advice was pretty straightforward. Add more fruits and veggies, maybe cut back on meat and dairy.
Makes sense.
Yeah.
Any other big lifestyle areas?
Smoking. Huge link to ED risk. Sources even suggested quick chats about quitting during urology visits could help. Chronic heavy drinking or substance abuse, also negative impacts.
And going back to the mental side, stress.
Oh, critical.
Yeah.
Chronic stress messes with sexual health dysfunction, lower libido. It can even trigger or worsen things for partners like vaginismus, which is painful muscle spasms, or dyspareunia, painful intercourse. So managing stress, absolutely key. Being present, relaxed during intimacy, that's valuable. They even mention things like diaphragmatic breathing, deep belly breaths. That can help relax the pelvic floor muscles which are involved, and it also impacts the vagus nerve tied to the stress response.
Wow, breathing affecting sexual function.
Yeah.
Another mind-body link. What about sleep?
Sleep got mentioned too, connected to hormone health. It's kind of the same theme. Good for your heart, good for your brain, probably good for your hormones and erections too. It's all interconnected.
Okay, so let's circle back to low testosterone, low T. Like we said, it's everywhere. Ads, conversation.
It really is. And the sources acknowledge that. They talk about the symptoms people link to it, though they can be kind of vague, right? Fatigue, low sex drive, mood changes, depression, brain fog. And yes, ED can be a symptom, but again, usually not the main driver in most cases.
So just because you have those symptoms doesn't automatically mean it's low T causing them.
Exactly. And then the sources got into testosterone replacement therapy, TRT. They basically said it's appropriate if someone is actually diagnosed low testosterone levels and they have significant symptoms.
And what really stood out was the need for careful monitoring if someone goes on TRT.
Oh, absolutely stressed. It's not a take it and forget it thing. It needs regular blood tests, careful follow-up. Depending on the type of TRT, they might check triglycerides, lipids, liver function too. It's a really vital part of doing it safely.
And the potential downsides, risks, side effects.
Well, a big one is infertility.
Yeah.
A large majority, maybe over 70%, can become infertile within about 18 months on TRT. Sometimes that's permanent. It could also speed up male pattern baldness, but only if you're already genetically prone to it. It won't cause it otherwise.
Okay.
And importantly, the sources were clear. TRT does not cause BPH, the prostate enlargement thing.
That's good to know. Busts a common myth. So it sounds like TRT has its place, definite risks, but can be good in the right situation.
That's the balanced view, yeah. The benefits can outweigh risks if it's genuine low T with symptoms, and crucially, if that monitoring is done properly. The real danger seems to be from sustained super high levels. And also, here's an important point. Once you start TRT, your body often just stops making its own testosterone. So for some people, maybe focusing first on lifestyle stuff, diet, exercise might actually boost their levels naturally, potentially avoiding TRT altogether.
Okay, that's helpful context. Now, shifting from prescriptions, what about the huge market for sexual health supplements? What did the sources say about whether they actually work?
Yeah, huge market is right. The general finding from the sources, pretty low-level evidence that most supplements actually help with ED or low T.
That's fascinating. Why so little data when there's so many products?
Well, part of it is how things are regulated. Supplement companies just don't have the same pressure or requirement as drug companies to run those big, expensive trials to prove they work before selling them. And, well, people buy them anyway, so the incentive isn't always there.
And there's a big difference between getting something from your doctor versus buying it online or off a shelf.
Oh, massive difference. Your doctor has legal responsibility. They're licensed. If something goes wrong with a prescription, there's accountability. Supplement companies can be much harder to track them down or hold them responsible if a product is harmful or doesn't work.
Did any specific supplements get mentioned?
Tongkat came up, maybe some data, but perhaps not a meaningful difference for patients. Saw palmetto was interesting, apparently well studied, but actually had the least evidence for helping with prostate health.
So the advice is pretty cautious then.
Very cautious. The sources really push trying lifestyle changes. First, they're natural, few side effects, unlike supplements which can have unknowns. If you do try a supplement, the advice was try just one at a time, see if anything happens. And a big warning, Be really skeptical if something promises instant drug-like results but doesn't list its ingredients clearly. That could mean it's secretly spiked with actual prescription drugs.
Okay, good warning. Let's switch focus a bit to prostate health. BPH, the enlarged prostate, becomes super common as men get older, right?
Incredibly common, yeah. The sources mention numbers like 80% of men having it by age 80. It's just very widespread.
And the symptoms, what did they highlight?
So the prostate sits around the urethra, the tube for urine. As it gets bigger, it can squeeze that tube. That leads to all those, frustrating urinary symptoms, trouble starting, weak stream, stopping and starting, waking up at night to pee, feeling like you got to go right now, going more often.
And were there treatments mentioned?
Yes, interestingly, low-dose daily tadalafil.
Yep.
Yep, the ED drug was mentioned as something used to treat the urinary symptoms of BPH specifically.
Okay. Now, prostate cancer screening, the PSA test, this is a big one. Lots of debate raises that question. Should every man get screened?
Yeah, the sources call this a rocky road because, well, experts disagree. Different organizations have different guidelines. The U.S. Preventive Services Task Force, for example, leans towards shared decision-making, basically, a conversation between you and your doctor.
What's the core tension there, the pros and cons?
Okay, so the pro is that screening can catch aggressive cancers early, when they might be curable. Before PSA, it wasn't uncommon for guys to only find out they had prostate cancer after it had already spread everywhere. So finding it early can be life-saving.
But the con?
The con is that screening also finds a lot of slow-growing cancers that might never have actually caused any harm. Finding those can lead to anxiety, biopsies with risks, and potentially overtreatment, getting surgery or radiation with significant side effects like sexual or urinary problems for a cancer that maybe didn't need treating. It's that tricky balance.
That makes sense. It's complex. What about the DRE, the digital rectal exam?
Also kind of controversial for just general screening by itself, but the sources said it's still a useful tool for urologists, especially if a man already has urinary symptoms suggesting BPH, because it lets them actually feel the prostate.
Okay. Let's cover a few other important areas mentioned in the sources, maybe things people don't think about as much, like the pelvic floor muscles.
Right, these muscles are super important for both peeing and sexual function. They help with control, involved in orgasm contractions for everyone. If they're not working right, maybe too tight, too weak, it can cause problems like pain, even pain when urinating for men sometimes.
And what can be done about that?
Well, seeing a physical therapist who specializes in pelvic floor health was suggested. Also, certain stretches, like the happy baby yoga pose, can help relax things. But interestingly, they noted that just doing Kegels without knowing what's wrong, that could actually make pain worse for some people if the issue is tightness, not weakness. So personalized assessment is key.
Good point. Not one size fits all.
Okay.
What about just basic hygiene and irritation down there?
Yeah, simple stuff matters. Good hygiene, obviously. If shaving, suggestions were go with the grain, use cream, maybe some cortisone after to reduce irritation. But a key point, if you have redness or irritation, it could be lots of things. Detergent, soap, friction, yeast, not automatically an STI. But a critical warning, if redness lasts more than, say, 4 weeks, get it checked by a doctor. Rarely, it could be a sign of precancerous changes.
Okay, important warning. Let's talk STIs, sexually transmitted infections.
This was stressed as a major point. STIs are very often asymptomatic. You cannot tell just by looking if someone has one. Absolutely cannot.
So the advice is?
Get tested regularly, especially after every new partner. That's just core health maintenance.
Yeah.
And protection. Use barrier methods consistently. Condoms for vaginal, anal, oral sex. Dental dams for oral sex on vulvas or anuses. Using condoms plus another birth control method gives better pregnancy prevention too. And talk about it. Open, factual conversations with partners are essential.
The sources also touched on anal sex.
Yeah, they noted it's becoming more common, even among straight couples. It does have risks, STIs mainly, and potential injury or bleeding if you're not careful. The keys mentioned were using lots of lubrication, taking your time, and absolute enthusiastic consent from everyone involved. Some people also use specific hygiene routines like enemas or diet changes beforehand.
Got it. And just quickly, urine health.
Right, basics like urine color yellow amber is usually good hydration. Clear might be too hydrated. Dark orange-brown suggests dehydration. Weird colors like bloody, cloudy, blue, green. Need a doctor check. Peeing more often could signal BPH or other issues. UTIs happen in men too, less common than women, but preventable sometimes with things like cranberry extract packs. Peeing after sex helps. Kidney stones. Main prevention is fluids, lots of fluids like 2-3 liters a day. Reducing oxalate foods might help some people, but if you get recurrent stones, you really need proper tests 24-hour urine collection, blood work to find the underlying metabolic reason, because there are specific meds that can help prevent them once you know the cause.
Wow, okay, covered a lot of the physical stuff. Let's bring it back to kind of full circle to the mind, the psychological, the relational side of things.
Yeah, back to that core idea.
Hmm.
The brain is the most powerful sex organ.
And we saw how anxiety and stress can really feed into that negative loop, especially with psychogenic ED.
Absolutely. And the sources also brought up how pornography and, extreme media portrayals can really skew people's ideas of what normal sex is. This can make people feel inadequate, like something's wrong with them, because real life doesn't look like this highly produced, often unrealistic stuff.
That's a really important point.
Yeah, the sources emphasize needing open, realistic talks about sex, about the huge range of what's actually normal and typical.
And how does that play into relationships?
Communication with partners came up as just vital. Talking openly about desires, boundaries, what feels good, expectations, it builds a kind of shared roadmap that can massively reduce anxiety, build trust, and just make sex better and more pleasurable for everyone.
Wow. Okay. We have really covered a lot of ground here, digging deep into men's sexual health based on these medical and expert sources. Hopefully, you listening now have a much deeper sense of how it all connects: the physical, the mental, the overall well-being.
Definitely. I think the big takeaways are pretty clear, right? ED as that potential health signal, the huge power of lifestyle, getting real about low T versus the hype, trusting professional guidance over maybe questionable supplements, and just how crucial communication and mental state are.
Yeah, absolutely. Our hope is that this deep dive leaves you feeling more empowered, more confident to have informed conversations about your health, maybe with your doctor, your partner, or even just understanding things better for yourself.
And maybe here's a final thought to leave you with, kind of wrapping it all up. Given how deeply interconnected all this stuff is, sexual health, physical health, mental health, what is really internalizing